Hi, my name's Cameron McIntosh. I'm an ENT surgeon and a board-certified facial plastic surgeon. So rhinoplasty is a specialized surgical procedure to improve the function and the form of the nose. What's very important to understand is that your surgeon needs to be able to not just make it look better, but it must work better. And the advantage with me being an ENT and a facial plastic surgeon means that I can deal with both aspects of the surgery. Patients often want to know how much a rhinoplasty is going to cost them. It's really important to understand there are a few very key things that influence the cost. Firstly, how much cosmetic work needs to be done. And secondly, are you on any medical insurance in terms of looking after the functional side of things? I'd advise you to please go to our website. We've got a lot more information about how much a rhinoplasty will cost you. Patients often ask me if their medical aid will cover their operation, and my answer is simply it depends on what kind of medical aid you're on and how severe are the functional aspects of the surgery that we're going to have to address. Over the years, I have found that with a comprehensive motivation as to why your nasal function is so poor, your medical aids will pay for your surgery. People ask me how long will the operation take. It also depends on how complicated the surgery is going to be. It can take anything from 90 minutes to 8 hours. On average, I do a rhinoplasty between 2 and 3 hours. Patients often ask me, what are the risks involved in surgery? So there are risks involved with any general anesthesia, but in terms of the surgery side, there are really two types. The first is the early complications, the second is the late complications. So early complications are things such as severe bleeding or severe pain. Late complications are if the function of the nose has gotten worse, or possibly the cosmetic outcome isn't the same as what the patient was expecting it to be. In terms of complications, generally the acute early onset complications we'll deal with early. However, when it comes to chronic complications or long-term complications, it's advisable not to have a rhinoplasty for at least 1 year so that all the healing and swelling is completely settled before a second operation is done. As a rule of thumb, I do not do any surgeries wanting to do a second operation. A second operation is not something that I plan on doing. I plan on doing it right from the start and getting the outcome that the patient wants from me. In rhinoplasty, the complication rate is between 4 and 5% for those surgeons who are doing rhinoplasty almost every single day of their lives. Patients very often ask me how sore are they going to be after the procedure, and my answer surprises them because I say you should not be in any pain whatsoever afterwards. You may have some discomfort with the fact that you have some stitches in your nose and you've got a plaster and you may have some packing inside the nose, but you should not be in any pain whatsoever. Patients often want to know what will they look like after the procedure. A lot of that depends on how much operating we're actually going to be doing on the nose. Some people also bruise with than others. As a general rule of thumb, you should not be too swollen. However, if the bones of the nose have to be broken, it may discolor under your eyes. You'll find that for the first week when you have your bandages on the nose, you'll feel some kind of discomfort. When it comes off, your nose will most likely be quite puffy from the edema. That should settle within a few weeks, but you'll only have your final outcome a year after surgery. So I see lots of sportsmen who come and see me for rhinoplasty so that they can have better nasal function, and they obviously want to get back into training as quickly as possible. As a rule of thumb, I try and keep them out of heavy training for the first week. By the second week, once I've removed all your bandages and your stitches, you should be back to about 80% of your normal training. 2 weeks after your surgery, you should be fully recovered to be able to train as per normal. If you are playing contact sports, you need to have a 6 weeks recovery before you can get back into your game. I operate both at the Life St. George's Hospital and at the Netcare Greenacres Hospital in the city of Port Elizabeth in South Africa. Patients often ask me if they need to stay overnight. The majority of patients do not have to stay overnight. However, if you are operated late in the afternoon, or if it's a very long case which you may need to have, for example, rib cartilage harvested, it's mandatory for you to stay overnight so that we can keep a very close watch on you. If you spent the night, I will see you the next morning, and if I'm happy for you to be discharged, you'll be able to go and recover at home.